If you're like me and you have trouble with aching joints, specifically your knees, I want to share with you 5 things that work for me when it comes to knee osteoarthritis relief. I'm going to share a bonus 6th tip at the end, but these things have helped me to the point where I am today, which is knee prehab. Okay, I'm well on my way to needing a joint replacement, but I've tried a lot of things over the years to calm joint pain before I got to the severe stage, and that's what I want to talk to you about today. We're going to make space for knee osteoarthritis and things that may help you. If you saw my video called Man, This Hurts, I'm talking about the physical, but mostly the emotional parts of having pain in the knee, or osteoarthritis pain specifically, how I feel with the threat of losing my mobility. I quickly realized that chronic pain is an emotional journey. So check that video out if you're feeling very emotional about your change in your mobility as you age. Perhaps we can have a conversation there, or here if you like. I won't tell you the whole story about my knee issues. It's been going on for a long time, at least 6 years. And it was the first time that I felt like I was experiencing ageism in the doctor's office. But suffice to say, last summer I fell on my knee. Like I just had a nice injection in my knee and I fell right on it. And it took about 9 months for everything to calm down. So I tried a lot of things, and that's what I want to share with you. And I'm going to be talking about both the regular allopathic stuff and a few natural solutions. And the first thing that I want to say is that no matter what you're feeling when it comes to issues in your body, symptoms, etc., go see your doctor. A lot of us want to muscle through, or we don't want to see a doctor because maybe we don't want to take medication. And I understand that medication can be a little scary. But when you see a doctor, you have a lot more access to diagnostics, right? X-rays, MRIs, even physical exams. Those things are very important when it comes to figuring out what's wrong if you're just starting down the road of knee pain. And when you get to the doctor, once you get all the imaging and you gather all that information, there are some things that might help depending on what's going on with your knee. So that's my first tip for you. Seek medical advice. Now, I did see my licensed physician, my licensed care practitioner. Of course, you have to have a license to be a physician. I also saw a naturopath, and I did see an orthopedic surgeon. So hopefully you're able to get on the road to that. Here in Ontario, it takes a long time to kind of get into the system, but all of these appointments were extremely helpful for me. Don't turn a blind eye to medical support. I love holistic health, okay? I'm going to share some natural things that I do and have done for my knee pain, but they don't always work. I mean, if you're like me and you've lost the cartilage in your knee, all the turmeric and curcumin and all of that stuff, the glucosamine, it can't build that back, at least from what I know. So some of the things that a doctor can offer you, and hopefully your doctor is as judicious as mine is, might really help you. So the first thing that I did under that umbrella, and I guess this is tip 2, like take a look at all of the medical interventions. I did a cortisone shot. Nope, I don't love that stuff, but when you are dying in pain, sometimes the cortisone shot helps. And I think in our system here in Ontario, you have to do that first before you can get to the next step. And I shouldn't say that. You don't have to do anything. You can refuse, but it is one of the things that they will recommend to see if that decreases the inflammation in your joint. And you can only have so many, so it's not like you're going to be putting that in your joints every month. Another thing that I opted for, and I'm lucky to be able to afford some of these things, is Cingal. So Cingal is a hyaluronic acid injection with cortisone, and it kind of makes a cushioning to keep that knee mobile and bending so you can push off having a knee replacement. The knee replacement is a little bit scary to me. Once they've manipulated your knee, you don't have your old knee. Not that I want my old knee, but the idea is that we're keeping these joints moving and out of pain, you out of pain as much as possible to get to the point where you're of an age to be a candidate for surgery. It seems like it is best to wait as long as possible to have your knee surgery. I'm on the fence with that one. To me, your health, my health would be better served if we can all move. We know that movement is healthy for us, but I also don't want to have the knee done twice, especially when I know I need another one, like another joint replacement on my other knee. Another thing that I tried was a compounded cream that had a bunch of different ingredients. I also tried a knee brace. So that's what I tried under the medical intervention umbrella. And I would say that Cingal injection has so far, the last one I had, been really helpful for me. So I have a bit more mobility, a bit less pain, and I'm moving more. And again, I'm lucky to be able to afford that. That's like $1 million knee. And that brings me to my second tip for you: movement. Movement, exercise, anything is technically medicine. Motion is lotion. And so I get it. If you can't move, I hear you. I've had the knee pain so bad I can't bend my knee. And you actually have to have a certain mobility to walk properly. When you can't, and that's even like the knee has to have a degree of almost bending backwards a little bit. And so when you can't move and walk properly, you can get a pain syndrome. So I had a neuromuscular syndrome that went right up into my back and right down into my ankle. And it was really almost embarrassing. I still have trouble getting down the stairs, but hobbling around the neighborhood, I could barely make it around the block. But I tried. I kept moving and I changed what I did. I did a lot of stretching. I did foam rolling. I tried to do gentle yoga. I still am very ungraceful when it comes to yoga, but I do that. I started Pilates because I wasn't sure if the lower back was playing a role with the knee. But whatever you do, movement, motion. Motion is lotion, movement is key, even stretching. We need to keep our mobility. And what I never really thought of as this like looming knee replacement is coming, and I'm trying to work it in as part of knee rehab. We need our upper body strength. Yes, think about it. If you are laid up with that knee replacement, that is no like shy surgery. That's a big deal. You need to be able to push yourself up and down on your bed. You need to hold yourself up on a walker. Yes, there's going to be a walker in my life at some point, but you need that upper body strength. So think about that. Even if we're in a chair, we can build strength. And before I get off of this tip, I want to say that Sherry Jibb, she has a channel here on YouTube. She has a community called Fit Gals. She helped me a lot when it comes to like positioning for Pilates and even strengthening my knee. And something that she has always said has really inspired me and has stuck with me on my down days of lack of movement. And that is the sentence: show up with the body you have. Make it okay to work with the body you have today. You don't know what tomorrow brings. And just working with the body you have, you're going to see improvements, and that will be in your mental health as well. My third tip for you is to try and build some stress resilience. We all have stress. Facing an illness is stressful, and I'm not saying that I'm facing something really super life-changing like a terminal diagnosis, but facing any kind of illness can be stressful. And I noticed that as I was trying to hobble around the block, I would tense up. I would also lie awake at night dreaming or thinking about how I might be like my mother. My mother was in a wheelchair for a lot of the last bit of her life. She had terrible rheumatoid arthritis, osteoarthritis. She had 2 hip replacements. She had a lot of mobility issues. And she was also a very active lady in her day. That scares me to this day. It still does. I spent a lot of time lying awake thinking, is this it? Like, what if this is it? I'm never going to travel. I'm never going to do the things that I want to do. And my social life was cycling, walking with my friends, hiking. And the thought of not having that still is, it's very hard for me. It's easy for me to talk about this now, but I kind of was thinking that like my entire summer this year was going to be not seeing my friends and going riding on my Tuesday nights and chatting with them and doing nice long sunny rides on Saturday. And so that really depressed me. And I lay awake at night thinking about what the future might bring. I did have to remind myself that all of this stress is not helping me physically. You have all kinds of chemicals that come out in the body when we're stressed. We use up more minerals. The worry also just compounds. So you're not enjoying your life. And trying to reframe things. I pulled some things from my mindfulness background. I tried to reframe things and really stay in the present, even so much as to feel very grateful for having the ability to make holiday dinners or dinners for my family when I used to feel kind of bitchy about that. Like I felt like everything fell on me. I tried to reframe things and take every day as it came and slowly move the needle on my mental health and my physical health. So, whatever it is for you, whether it is connecting with someone that you can talk to, finding a therapist, taking time to not surf the internet and look for more solutions or scary stories about your pending knee replacement or whatever it is you're facing that can help your stress response and even your overall pain response, because we're wired in our brain for pain. Yoga has been really helpful with that because I have to concentrate on what my body's doing rather than on my like thought spiral of the future. I pulled on a lot of self-compassion work for that. Not every day is perfect, but hopefully this gives you a different thought process. You can explore some of these things and see if they work for you. And certainly if you have any questions, pop them in the comments. So number 4 was paying attention to my diet. I feel like discussing food on the internet when I have learned the non-diet approach is such a dicey situation. And so when I say paying attention to my diet, I do mean nutrition. I was diagnosed with osteopenia as well. So things that would build my bone, things that would take away from bone mineral, those parts of diet are very important to me. And I was also told to lose weight when it comes to caring for my joints. I'm going to make a whole other video about that. I think that deserves its own airtime. I will say that none of us are alike, and each of us has to choose our own journey when it comes to weight loss and knee pain. We can look at the research. Some of it is strong. There is some research that says there's other things that might come into play when it comes to weight and sore knees or osteoarthritis of the knees. I think there's merit to all of it, and we have to look at ourselves as individuals. So if you'd like to hear me talk more about weight loss, and maybe a more balanced thought process when it comes to osteoarthritis, pop that in the comments. I'd love to make that video for you. Suffice to say, I am paying attention to my protein intake, fiber, and yes, sources of minerals, calcium. Vitamin D is an important supplement that I take. There's even some controversy on vitamin D, but that is something that I am really paying attention to and thinking about, even my coffee intake when it comes to my digestion and minerals and absorption and all of that. The 5th thing I'm going to chat with you about is natural remedies. There is a lot out there that can support you naturally when it comes to joint pain, directly or indirectly. One of the things is digestive support, so you're absorbing those minerals. Another thing is making sure that you're getting your vitamin D and making sure that depending on the dose that you're getting, I mean, you really should be taking that with K2. Sometimes supplements will come together with those 2 ingredients, and sometimes you have to take them separately. Speak to your doctor about your own vitamin D status and get a test to make sure that you have adequate blood levels of vitamin D. Vitamin D does work with other minerals. I have a video on bone minerals in menopause as well. Look for more on that coming up, but it is something to really think about. There are lots of anti-inflammatory herbs and roots that you can take, things like omega-3 fatty acids, which are also good for cholesterol. You can look at ginger or turmeric. I have a supplement that I did take called Inflicom early in my days, and that had multiple ingredients that were anti-inflammatory in the body as well, and that can be really helpful for you too. But this is something that we don't want to shy away from. There are natural remedies that can help. I mean, like I said in the beginning of the video, if your cartilage is obliterated, all the curcumin isn't going to bring that back, but it may help you as you start in the early stages of inflammation and pain. But you do want to think basics. Are you getting enough vitamin C to help you build collagen, the vitamin D, the protein, zinc, all of the minerals, and think about your digestion as well. And a stressed person is not going to have good digestion. So that's 5. I would really love to add acceptance and adaptation as like my bonus 6th tip when it comes to managing all the changes that life is going to throw at our body. We can't change our genetics. We can't change our environment sometimes that we've grown up in that plays a role in our health. There's things we can't change. And so we do have to learn to adapt. And that sucks, right? It sucks, but it's part of aging. And I always say, If we are here getting older, we're lucky to be doing it. Maybe I am lucky to have to work on my acceptance and my adaptation as I move towards, hopefully, a ripe old age, and hopefully with my goals of still walking and still reading and moving around past my 80s into my 90s again, if I'm lucky to be here. Thank you for being here. I'm lucky to have you, and I really look forward to seeing you in the next video. Please like, please subscribe, and please leave a comment and let me know how you're doing.